Hello, wonderful people. Today we have a very wonderful guest, Dr. Shani Cooper, who will be telling us about fibroids, hysterectomies, and all things gynecology. So, welcome, Dr. Cooper.
Thank you, Dr. Miles. It's great to be here.
Can you please tell us how you got started with being interested in gynecology?
Absolutely. I started from my own story. I was diagnosed with fibroids in the early 2000s after many years of dysmenorrhea, painful periods without really great answers from the Western medical doctors that I was seeing. Their solution was let's alter your birth control pills, which with anyone who has dealt with the altering of your natural hormones, things can go a little haywire and nothing ever really seemed to be resolved for me. Um, so it kind of led me to a path where I was in a massage class and we did a really brief overview of basic Chinese medical theory and its ideas. And a light bulb came on for me. And it made sense for the first time why I had experienced certain symptoms, why my mom had experienced certain symptoms um, throughout her life that led to her hysterectomy shortly after my birth. And it just led me down a path where I decided to go ahead and change careers completely and become an acupuncturist and now get my doctorate. So understanding the way a menstrual cycle is supposed to go is something that I don't feel is very clearly explained to women in this country, particularly when things go wrong. Personally, I feel like Western gynecology has been held back by the invention of the birth control pill because the birth control pill does so many other things than just prevent pregnancy. It can help regulate a period, it can help with painful periods. And so, what we wind up having is this band aid for issues that don't really get explored for a lot of women, which leads to such staggering statistics like I think it's 50% of African American women at the age of 35 have fibroids,
Mm-hmm.
80% plus by the time they hit menopausal age. Um, and it's 70% for Caucasian women. So they're not that far behind. And it's the number one cause of hysterectomies in this country. So having a better understanding of that, I feel that traditional East Asian medicine has just explained a lot of that a lot better cultural wise than we have in this country. So that's what led me on this path.
Awesome. So, what kind of experiences have some of your patients had?
Well, I've had several patients that have come to me for primary dysmenorrhea, which is just menstrual pain. And what we've been able to do is within about 3 months with herbs and acupuncture, we get them on a track where they're experiencing less, if any, pain during their cycles. Um, and I've had some patients who are trying to avoid hysterectomies because they already have fibroids. Um, and the size of their fibroids are just big enough that they cause symptoms, but not to the point where they're trying to avoid surgery. They don't necessarily want such a strong intervention and are looking for alternatives and being able to help mitigate their symptoms, being able to help them not get as tired during their menstrual cycle, being able to reduce the the heavy cycles so that they can actually treat that week out of their month like closer to a normal week out of their month, as opposed to for some women it's 3 weeks out of the month that they're just down because of their cycles, because they're tired beforehand as the body gets ready, and then they're tired during because their blood flow is so heavy, and then they're tired after because now they're blood deficient, as we would say in in our medicine. um, and usually, and sometimes they are officially anemic all the time because of such the heavy flow. So being able to build them back up, build their energy back up, being able to control that flow a little bit so that they can maintain more of what they need to get through their day. That's a lot of what I focus on when these women come to me, so that they can maintain a quality of life that without having to alter their hormones, or hopefully um, without having to go the hysterectomy route, which comes with its own list of complications and concerns.
Do most of the women coming to see you understand that the same hormonal imbalances that are causing their menstruation to go crazy are also responsible for so many of their other symptoms? Do they understand this before they see you, or is this something that you have to kind of teach them slowly?
Some women do. I feel that women, I've had a couple of patients who've come to me as kind of like a last ditch effort, who have been in front of enough MDs that they have started to connect some of their own dots for their symptoms. Um, some of what I find is the younger women who come to me are the ones who are a bit more surprised at how how the systems are all connected. You know, how they're how many of their symptoms truly are part of their premenstrual syndrome, um, as their body gears up for their cycle, as opposed to women who have kind of who are usually closer to their 40s, who are close to their menopausal age, who have just, by way of, checking off lists and talking to mom and grandma, have figured out, okay, well, maybe this is somewhat connected. It's the younger women that I find that tend to be more surprised that, oh, the fatigue and sleeplessness and insomnia could be connected to also the fact that I have menstrual pain, and maybe the fact that I have these other things happening.
Mm-hmm. So, as you're treating their menstrual pain, you're also seeing a system. As you're treating their menstrual pain, you're also seeing kind of a cascade of their other symptoms going away. Is that correct?
Absolutely. What I find is, I can think of a patient right off the top of my head right now. She came to me with menstrual pain, um, basically drugged in by her boyfriend, not realizing what we could do for her. And within I would say within 2 weeks, she came back saying that she was sleeping better for the first time in months. Um, and then her next cycle also was less painful. And I try to, you know, control expectations. Sometimes we can, hit it right away, and their next cycle, we just get them at the right time, and their next cycle is improved. And sometimes it takes a cycle or two.
Mm-hmm.
But people do find that, they're a little less on edge during their premenstrual, time. They don't want to take as many other people's heads off, as well as sleeping better and having more energy and just enjoying life a little bit better. And then, oh, by the way, this thing happened again, without it having to, mean days off of work and things like that.
What is your treatment process? Are you largely doing acupuncture, or are you giving them homework to do? What does it look like when people come to see you?
For me, it's a combination. It's common. I Lifestyle. I try to encourage the fact that what we do together, maybe an hour a week, maybe if we're lucky 2 or 3 hours a week, cannot make up for the other 24 hours of every day that you get to spend with yourself. So we try to talk about things like sleep hygiene, if sleep is an issue, dietary changes that can derail their progress, as well as adding botanicals to their routine as well. Um, I have started playing with the idea of, less is more, in terms of how I can help others truly take responsibility for their own health and the things that they do to improve their own health. And really, because what we do is powerful, and I feel like what I do in treatment is important, but it's only a part of that puzzle. So encouraging, if you're a pot a day coffee drinker, explaining how caffeine can affect all of the things that we're working on, and maybe you should cut it back to 1 cup a day. And here's a really great tea that's a replacement, that's actually also an herbal formula that's going to help. Um, and when you get stressed out, let's practice a breathing exercise while you're here on the table, something that you can do 2, 3, 4 times a day before you go to bed, to help um, relax your nervous system and help your body adapt to the changes of everyday life. Um, and through these processes, I've noticed that my patients come back a bit more aware of their bodies than they were before they
Hmm.
started visiting me, um, which starts to really just open the door for them and taking more control over their lives and their symptoms.
Do you find that they're not clued in to that aspect of their body because it's associated with some cultural taboos? So people don't tend to talk about it much, and then do you think that causes people to sort of just shut down mentally?
Absolutely. I it is my one of my theories, especially as a woman and a woman of color, um, that what oftentimes happens in our lives is we're required to do a lot of things, wear many hats, and there is no hat for self-care. There is a hat for being a mother, being a home taker, being a breadwinner, um, being the amateur mechanic, being the amateur plumber when things go wrong, so that you can talk to the pros and not
Get
lose
ripped
money
off, yeah.
because it get ripped off. Exactly. I specifically remember my mother having conversations with me about sometimes, baby, you're just going to have to do it all. And thinking, well, that's a little messed up. Like, how am I supposed to do everything? But in essence, that's often what we get called to do in our culture. And on top of that, do it with a smile on your face, with your appearance, appropriate, and with a light heart. Meanwhile, you're maybe in pain, maybe something hurts, maybe you didn't get any sleep last night and the kid kept you up, but you're not really allowed to complain about that. You're really not allowed to say too much about that. You're supposed to
Mm.
just kind of keep going, show up for work on time, don't be late, and don't be short with your customers if you deal with customers. Um, so yeah, I do feel like there is a lot of responsibility on women to do more with less at all times and to do it with a smile on your face. And so we don't talk about, these are the things that I'm dealing with every day that keep me from feeling at my best. And so we start thinking of self-care as a luxury, and we start thinking of self-care as something that the haves get to worry about, and that, oh, you're just complaining if you're taking time out for yourself. um, and then and that's kind of where I feel like this kind of connects back to, understanding how our bodies work and why women are so prone to getting fibroids, and why we're so prone to getting hysterectomies because of those fibroids, because they didn't start, not one fibroid started the size of a grapefruit.
Hmm.
It started small. The symptoms were there, but they get brushed to the side. And so by the time you're forced to pay attention, maybe you've tried to have a baby and had a miscarriage or something like that. Now you're being forced to look at it and you're forced to make it a priority. When if you would have done it 5, 10 years ago, we could have looked at it as a more preventive. Let's control your symptoms. Let's look at what's going on. Now we have a grapefruit to take care of when we could
Hmm.
have taken care of a pea.
Do you find that many of the root causes are, do you think they're more emotional or dietary? What, I mean, obviously multifaceted, but what would you say if you had to point to one as the largest contributing factor?
Emotions really do kind of wag that cycle, because many there are women who are emotional eaters or emotional non-eaters.
Mm.
So when you want to look at diet, that can stem up from emotional stuff as well. But not speaking to you know what may be going on in your life, not speaking to when you feel like you're being mistreated,
Hmm.
when you feel like you're getting the short end of the stick, maybe you're feeling overlooked at work, maybe you're feeling overlooked at home, or even in the classroom. When we're just starting out, um, there is something to be said for stuffing those things down,
Hmm.
and now we have a growth that doesn't necessarily belong there.
Mm-hmm.
Um, if you want to get in the more esoteric ideas of the medicine, um, uh, uh, the body is kind of like a magnet, for everything we don't want to deal with. It will find a place for it, whether it mess up your digestive system and you can't stay out of the bathroom, or you can't get to the bathroom, um, or maybe with fibroids and masses like that tend to grow seemingly out of nowhere. um, I do feel like that's kind of part of the process, which is why I really like the gasotransmitter exercises that I've been starting to incorporate in my treatments, because it really does allow people to take that deep breath that they may not be taking all day, and to say, I don't have to hold on to these things, and I can find a way to exercise them out
Mm-hmm.
of my body.
When I was probably 14, my mom came home a little bit shaken. She had been to the doctor and they said she had a fibroid about the size of a grapefruit. And immediately their response is, of course, surgery. And she decided not to do that. And instead, she took about 2 hours a day to do the pulse gasotransmitter exercise, kind of as a meditation, feeling her pulse, feeling her heartbeat, finding the rhythm in that. And after about a month, it was gone. I mean, she just
Wow.
this was right after her dissertation. She had been under extreme pressure for quite a while, and I think that just as you're saying, that was the physical manifestation of that.
Yeah, it's funny because I can, as you tell me that story in my brain, there's two people who kind of pop up. One who's like, "That's amazing, just with gasotransmitter exercises, just with breathing, 2 hours a day." And then the other part of me, that older part of me, stands up and says, "Who has time for 2 hours a day?"
Yeah, she
But
shuffled her
then,
life quite a bit to do that.
but that's a priority, right?
Mm-hmm.
We get this one vessel to get through this life, and that's what I think our job is to relay to our patients is, okay, you can do this for 2 hours a day and say, this is important to me,
Mm-hmm.
or add up the hours you're going to lose for the 6 weeks worth of recovery from surgery, and then the hours that it's going to take you to get back. And all of a sudden, 2 hours a day seems like a really manageable,
Mm-hmm.
situation. So I think that's a great, excellent example of what it really takes to be in tune and be present, if that's what you choose to be, in this life.
Mm-hmm.
Um, so yeah, that's a great story, and a great example of what self-care truly is. And it's just one of the jobs that we are given with the responsibility of this life,
Mm-hmm.
to take care of this vessel. Because one of the sayings I give to my patients, if you're giving out from your cup constantly and never refilling,
Mm-hmm.
then what good are you to the people you're trying to give to if your
Mm-hmm.
cup is empty?
Absolutely. Can you talk a little bit about hydrogen sulfide and its role with the reproductive system?
Oh, so this has been quite the rabbit hole as of late for me. Understanding the delicate balances of these gasotransmitters, the nitric oxide as well. Um, it's and its important role in maintaining the critical balance of the reproductive hormones. Um, I don't know about you, but when I learned where exactly your hormones had to be in order to reproduce, like there's that perfect sweet spot, that it's so exact. And if you miss that mark, because everything's not balanced, you miss your chance for a month. And yet people keep getting pregnant. And you're
Mm-hmm.
like, how does this ever happen? How can it ever be just so? And yet everybody comes into play at the exact same time, and magic happens. Um, and so when I started looking into these gasotransmitters and how they affect the reproductive system and how important they were, It kind of makes sense in terms of, well, it definitely makes sense in terms of, if you as the vessel of, as as any part of that process, if your gasotransmitters are not communicating well, if the nitric oxide is just a little too much or a little too less, if you're you're I just had a brain fart, sorry.
Hydrogen sulfide.
Hydrogen sulfide levels are not balanced and communicating well with the nitric oxide. You you not only miss your chance at conception, things also start to misspeak to each other, is where the way I like to explain, especially things like fibroids. We can have a conversation and things flow, and then we can have a conversation and be antagonistic.
Mm.
Um, and so something will still grow. It's just not what's supposed to be growing.
Mm.
And so what you wind up having is this miscommunication, and these cells reproducing and becoming sticky, and becoming, this adhesive um, mass that is feeding off of the everything as well. So
Mm.
that's it's just scratching the surface as of
Right.
late in
Hmm.
my own research in that.
What I found just personally with women who have fibroids is also symptoms early on of what we would call, kidney chi deficiency as
Mm,
kids, and then one of the main sources of gasotransmitter production is the endothelium, and in particular the uterus, which is right below the navel, that area, which would be the dantian. So that should be kicking up this kidney chi that's causing the reproductive system to be smooth and flowing and regulating blood viscosity. And it's
mm,
interesting because it seems like when that is kind of just off from birth, then come the fibroids, then the hysterectomy, then the weird fibromyalgia pain comes down the line. It's just kind of like, I mean, of course you can offset it, but it's just like a train that's on its way and it has these different stops that are just painful.
absolutely. The altered gene expression that happens, it's like flipping on a light switch. And if nobody told you that the light was turned on in the house to begin with, and you're out and you're not even focused on the inside of the house, you're too busy focused on the outside of the house,
Mm.
what are you going to do? You're not going to pull the power. Um, and it affects so much more than just the reproductive system. One of the things that I was researching, earlier, was looking at the role of prostaglandins, as we were discussing, and understanding their role not just in the inflammation process and the control of the inflammation process, but it also controlling your ability to stay healthy and not get sick, being able to provide that what we call wei qi, the your the way you move through this world. And and if that's not regulated, then nothing is regulated. If the outside is porous and everything can just come in, and then on the inside, like you said, is off, it's like from birth, there's so many on switches at that point, that you're looking at, that just leads to chronic pain and inflammation. So it's almost spelling out. And then the fact that it's generational as well, it, my question has started to become, how do we start to have this generational conversation so that we can start turning these switches off, or at least being aware that these switches exist
Mm-hmm.
as we come into this world, so that we can, as hopefully as a family, try to change what our family stories are.
Mm-hmm. So you mentioned some concepts that many people might not be that familiar with. The first would be the role of prostaglandins, which are important in reproductive health, and also their effect on the larger immune system, and back and forth. So if you have a weak
Hmm.
immune system, that can mess up your blood and inflammatory factors in the blood and vice versa. And this is going to control how thick or thin the blood is, blood circulation, timing of menstrual cycles. And as you were mentioning before, that that's the on and off switch. That's the gene methylation, and this can happen intergenerationally, maybe due to just family education, maybe due to intergenerational trauma. It's all so multifaceted. So it can look like this really complex soup, even to psychoneuroendocrinologists. They look at some of this and they get like, where do you even start? But thankfully, we have such a root in tradition that we really have a roadmap, and then that gets supported with biology as it's coming out. So it was interesting you were talking about the hydrogen sulfide and the nitric oxide either communicating as one is an oxidant, one's an antioxidant. So they're either talking to each other, supporting each other, or they're fighting against each other. And then as they're fighting against each other, you get this literal kind of fire and ice, fire and water sort of metaphor that's causing this internal chaos. And it's so interesting that we have these ancient metaphors that are playing out real time in the body, and they're affecting every part of us. So you start with your patients by having them look in a little bit and do these gasotransmitter exercises. Then what kind of, can you give us a story of one person in particular, maybe not saying their name, but what their story was like having come to you and using this information to transform their lives on all levels?
Absolutely. I had a patient. She was, I want to say late 20s, early 30s. Um, her partner had come to me. He had had a injury, and we had started talking. He had brought up his girlfriend's issues in terms of being bedridden almost every month. Um, we we got her in. We got her on the table, and it was really hard for her because she was losing at least a day or two a month from work. Which affects your ability to feel like you can pay your bills for
Mm-hmm.
those who are hourly paid. Um, but then also she would just have anywhere from a week and a half to 2.5 weeks where she just didn't feel like herself. She wouldn't feel like going out. She was bleeding so heavily throughout the month, throughout her cycle, that she was tired before, she was tired after her cycle. She felt bad because she had to ask her partner to, kind of do more, or had to turn down events. So that would kind of cascade with the kind of pre-menstrual depression that she was already getting. Um, so it took it took us about 2 cycles before she felt any significant difference in the pain. Um, but in terms of boosting energy, helping her get more productive sleep, that's something that we started to see after the first few weeks. Once her botanicals started kicking in, once we started playing with her breathing and her really looking inward, and taking that time, and also forgiving herself for when she had to say no and when she couldn't be everything she wanted to be, which
Right.
I find to be a huge missing piece of the puzzle a lot of times. It's okay to have a bad day, and it's
Mm-hmm.
okay to just kind of let that go. Um, and so we were able to get her to a point where um, she wasn't relying on NSAIDs as much during her cycle. Um, she was able to better predict how long her cycle was going to be. She wasn't down as many days. She wasn't missing work. Um, and about every 3 cycles, it was a really interesting. She was one of my first patients that I saw a really, 90-day cyclical situation where every 3 cycles or so, the symptoms would kind of try to come back.
Mm-hmm.
But let's say if she was a 8 out of 10 when she was coming, um, that every 3 months was maybe 4 out of 10.
Mm-hmm.
So the fact that her peak was significantly less, um, I saw as a win, and so did she when it came to quality of life and her ability to um, move forward. And it also made her more aware, because we did talk about how these, she was young enough that this is fairly early in this cycle to be aware of when things start to worsen, so that you can head off any bigger things down the line, such as fibroids or run the risk of needing a hysterectomy.
It's so interesting, these rhythms and cycles that we have. You know, you've got the breath and the pulse, and then people are well aware of the monthly cycle, but then, as you mentioned, a 3 month cycle, and of course the 9 month cycle and 3 year cycles. And it's, it's interesting that we have so many of these, and we may pay attention to one if we're lucky. You know, if people are really kind of
Yeah.
holistic and introspective, they'll be like, oh, I'm paying attention to my breath, but maybe not the pulse, and
Hmm.
then maybe the monthly cycle. But, you know, our lives are just governed by these waves and cycles, and getting those harmonious is just the rippling effect that, you know, you and her both were able to have on her life. And the thing that you said that just hit me right in the heart was, Jesus, she's feeling bad because her body is gearing up to produce life, and that's not seen as activity. That she, you know what I mean, like, she, it's like she's a
Yeah.
crippled man. You know what I mean, like, why are you being such a crippled man? Because I have the goddess like ability to create life. I've geared up for it. But that's so disrespected that that's not seen as work. In many traditional cultures, that's seen as, you know, being equal to sweat. You know, they have the idea of
Hmm.
sweat and blood. I know many Islamic cultures, they talk about, you know, a woman producing blood every month, that a man has to sweat 10 times that amount to kind of equal it out. And just the cultural disrespect for that is just, I mean, no wonder people get depressed. God, if I had to sweat 10 times the amount, and then people were like, pick up the slack, why are you being such a wuss?
Exactly. And that goes right back into that, also do more with less, you know.
Mm-hmm.
I want you to feel 60%, and then I want you to still do 150% worth of the work. And I want you to collect 73 cents on the dollar for it. You know, like there's
Mm-hmm.
it's just adding insult to injury, and not looking inwards and saying, "Hey, this is a big deal." Um, and it also, one of the things you just said actually kind of made me look at that bigger picture, especially when you look at the chronic illnesses that some of these patterns can lead to, like the chronic fatigue and the fibromyalgia and things like that, that you can't see,
Mm-hmm.
right? I can't see that you're in pain. But being in pain, anyone who's been in real pain, which most of us have experienced something, whether it's a sprain or strain or a break or something, um, it takes a lot out of you to endure being in pain.
Mm-hmm.
You know, it makes it hard to sleep. It makes it hard to be. And I can think back to when, I was on a very regular basis experiencing 8, 9 out of 10 pain every month. Just because it was in my abdomen doesn't mean I didn't feel it when you hugged me.
Mm-hmm.
It changes you systemically. And so, to not be able to forgive yourself for not keeping up with all of your commitments when you're in that kind of pain
Mm-hmm.
only leads to more emotional pain, which only leads to more physical pain. As you know, that's one of the things I love about this medicine, is that we don't look at those as individual items. They are part of the whole, and you have to respect the whole in order to even comprehend, where to start to fix, or help fix or heal. Um, so that's always mind blowing to me, how you can dictate what someone's pain is. It's like,
Mm-hmm.
oh, you should be fine. Um, but then you should also, okay, if I can acknowledge the fact that you're not fine, I also need to acknowledge the fact that, how can I help you be fine with not being fine, and
Mm-hmm.
finding a happy medium that can allow you health and rest when you need it. And I think that's something that, we've really lost in our culture, trying to be the best at everything, and trying to be so stoic and so, like, independent. That's one of the things that I struggled with personally, with my upbringing, is, you are a strong, independent woman. You can do it. You don't need anyone else. You don't need to ask for help.
Mm-hmm.
And that only serves to disconnect you even more from what's normal. What is my body doing? I don't have time to think about what my body's doing. I'm trying to be a strong, independent woman, um, and not recognizing those as exclusive things.
Mm-hmm.
That those two things can communicate together, and I can be that strong, independent woman, and I can also say, no, I need to cancel my day today to
Mm-hmm.
to take care of that strong, independent woman, because if I don't, who's going to? Um, and that's one of the things I try to relay to my patients. It's someone's got to take care of you, and
Mm-hmm.
if not you, then how can you expect anyone else to be on that team either?
Absolutely. One, it just strikes me, and it's a bit of culture shock or cultural faux pas that I guess I have. In China, you can be out at a dinner and just meet a woman, and it's a big group of people. It's maybe a nice restaurant, and she'll talk about her period. And just mentioning that, it's like it's ridiculous, and people will say gross, right? There's all of this judgment that comes up with it. But there, it's just like I'm off kilter a little bit. Then somebody may mention, oh, have you used heat? Or you've got to see my friend who's a Chinese medicine doctor. Oh, okay, cool. But then it's also understood, like people will say, oh, I'm on my period now. So that also means that will affect what people order for the meal. It'll be less cold foods, less of the raw
Mm,
foods, more warming. And then it'll
mm,
also factor into, okay, after this, we're not going to go swimming because a few of our friends here are on their period. So, but there's no taboo about it. It's not something that's seen as like dirty or gross or whatever. So I come back to the States and then I'm like, oh, you walking a little funny. Are you having period pain? People are like, what? But that's a perfectly normal thing,
yeah.
in China because it's fertility is more respected rather than kind of vilified to the degree that it is here. It's like something shameful.
Well, I think our pitch, the once again, that striving to be just as good as and keeping up with everyone else, it's kind of seen as a weakness.
Mm-hmm.
It's like, oh, that's a reason why you can't be 100%.
Uh-huh.
So number one, and number two, yeah, what in this country we do not like to talk about bodily fluids of
Mm-hmm.
any sort. Like
It's
that's
true.
a very
Yeah.
personal thing.
Mm-hmm.
Like, you go handle that,
Right.
and I'll see you later.
Mm-hmm.
And that's like, it's very hush hush, and I think that that's something that starts very early on, in whatever version of sexual education that you think is appropriate for kids. As we start learning about our bodies, um, they immediately start separating us and putting us in two camps, because we can't, how dare we talk about blood in front of the boys, like
Mm-hmm.
it's it's something that we're taught from a very early age, that that's a personal story. That's a that's not something that you bring out
Yeah.
into
Women's secrets,
the
right? Yeah.
light. Exactly, exactly. But that has such a deeper history than I just remember a story my mom told. So my grandmother, there's two sets of kids with about a 7 year gap. And if you know anything about old school birth control, but diaphragm lasts about 7 years before you need to get a new one. Well, back in the day, you had to have your spouse's permission in order to get a new diaphragm. And my grandfather was like, well, these other women don't keep getting pregnant. You shouldn't have a problem. And so he didn't sign off on it. So there's a second crop of aunts and uncles, um, about 7 years later. And it just it's just, that's one of those big stories, at least for me, that just shows that glaring disparity of what should be a cultural norm. Like,
Mm-hmm.
it's no secret how we keep making more humans, so it shouldn't be a secret of how these processes and cycles work, and it shouldn't be a secret how we can help mitigate and support one another as we all go through life. Um, and it definitely once again, this is why I was drawn to traditional East Asian medicine. So many things that what we call medicine in this country is just what you do, you know, it's just part of the culture in China, is part of the mindset, part of the way we just treat each other with a little bit more just it just baffles me. It baffles me that we have separated ourselves so much from each other, and so much from ourselves, that yes, we cannot by any means talk about pee or poop or blood or anything like that in a public setting without getting funny looks. Even in a private setting with a patient, the second
Hmm.
I start asking about, so did you poop today? Oh, well, I can't. Yes. It's like, okay, we all, especially in this medicine, if you're having period cramps, there's a good chance I know exactly what your bowel movements are like pre and right before you start and right as you start. And if it's not that way, then that sends me to a different direction.
Hmm.
And it's even in that private room one on one, you can feel the shift, like, oh, I'm about to let you in on such this personal aspect of my life.
Hmm.
And which is just a prime example of how we're so disconnected from ourselves.
So I've had many patients say, well, I just can't wait to get a hysterectomy because then I won't have to deal with my period anymore. And that's something that I've never heard from West African women, from Arabs, from Chinese women, Korean women, Mexican women. It seems to be a really an American thing. Like, let's yank this out and I don't know, toss it into a jar. I have no idea what people are up to, you know? Like, yeah, this is just
Put
gonna.
it on the shelf.
Right. So, can you give some reasons or examples of why it may be better to work on menstrual regularity and work on the fibroid itself rather than just to, take out a uterus? Keeping in mind there are always, some severe cancer or something. There are times for a hysterectomy, but this kind of
Hmm.
almost like for convenience sake, what can they expect down the road if this is the approach that people choose?
I always try to impart, to women that even though, yes, there are different ways to do the surgery, whenever you cut into the body, things will never be the same. Um, Sometimes for better, um, but there's always the other side of that. Um, if you want to just start, when you look at scar tissue, replacing healthy tissue, it doesn't heal the same. The cross fibers don't line up the same. Um, the numbness and the tingling that doesn't always go away. Um, and the other symptoms that kind of get thrown out of whack. One of the biggest examples I give to some of my patients is just the natural change of menopause in and of itself, and the fact that estrogen in our systems as women keeps our cardiovascular, disease rates lower than men's until we go through menopause, and then we meet theirs. So if you're looking to understand how important just one of these hormones are, now look at taking out the entire system. First of all, you're taking out a organ system that you were born with, um, which has always kind of set odd with me. But now you're replacing that with scar tissue, and you're kicking off this hormonal cascade that can actually lead to more systemic pain and inflammation down the line. Um, and understanding the lipid control that happens with estrogen, and understanding that that's the cholesterol level rates that increase afterwards. Um, and something I recently discovered looking at some of the statin side effects to control those cholesterol rates, the list of side effects looks shockingly like the signs and symptoms of fibromyalgia and chronic fatigue. Um, so you're not, I, in science, we look at, there's never there's never an equal exchange. where you get nothing in return. You can't take something out and just say, okay, now you're going to be symptom free. There's always an other side to that. There's always a dark side of that moon that you have to take into account when you look at something as major abdominal surgery. Um, I just, it bothers me that we don't look at that trade off as the other side. And I think it goes back to a lot what you were saying about, the way we don't talk about our menstrual cycles, the way it's such a taboo subject, that these organs get looked at like an inconvenience. If you're not in the active process of making a baby, then what do you need a uterus for? What do you need your ovaries for? So let's just yank them out. Um, which only leads to other health issues down the road, that aren't as easily managed as preventative menstrual management.
So you mentioned
So,
the healthy estrogen levels and menopause and how that can contribute to cholesterol. Once people have hysterectomies, they tend to go through an early menopause. I mean, even like,
mm-hmm,
35, 36, women are
mm-hmm.
waking up with, with hot flashes. And it's basically, if you look at it, that's everyone's putting skin creams, on to reverse aging. But you yank out a uterus, you just got 15 years older overnight.
And I can almost guarantee you that not one of these women who have made that decision has had it put in such a way to them. They see it as this is going to be a savior. This is going to help me not suffer. And there is no, and because of the way, the healthcare system is really kind of pushing sometimes people through, it's hard. We're not looking at the other side of that. We're not looking at the fact that, yes, you just aged that 35-year-old 15 years. What possible complications are we going to bring to her life now that she wouldn't have had to deal with for another 15 years? That if she thought she didn't have time for what she was going through now, she definitely doesn't have time for it now at 35.
Hmm.
So it's just I liken it to a band-aid over a sucking chest wound. Okay, you're gonna see a benefit, sort of, but you're not really getting to the root of the problem. You're not really digging deep and seeing, okay, well, what led us down this path to begin with? Because that disease process didn't stop just because you had a hysterectomy.
Hmm.
That disease process did not stop. You've still not learned to deal with your emotions. You've still not learned to change your diet. You've still not learned to get better quality of sleep. You've still not learned to find more natural solutions to control your pain. Um, and now you've got 6 weeks down from work to also not deal with it either. So,
There are two aspects to pain and fatigue. I'm just thinking of when we look at pain and fatigue, oftentimes people are either put into groups as a whole, and then older research tends to be men only, and it's looked at like women are sort of just smaller men. But I mean, just by weight, right?
mm-hmm,
But then you look at the role of prostaglandins on systemic body pain and estrogen deficiencies as sources of body pain. So it's very fair to look at women's pain as unique and separate and special compared to men's pain, and respect those physiological differences as you're looking for the root of those areas of pain and fatigue.
mm-hmm.
What kinds of pains, I mean, obviously different from, I shouldn't say different, but maybe related to menstrual pains, might you find contributing to neck or shoulder pain? What kind of sensations might a woman feel or experience even after a hysterectomy that would lead you to say, okay, this type of body pain that you're experiencing, it's still related to the same underlying root as your menstrual irregularities even after the hysterectomy?
Yeah, absolutely. I've I've talked to some women who still get that low abdominal pain, and they're like, "What? there's nothing there. What I tend to see a little bit more is back pain. Um, I've got low back pain, and I've got a stand up desk now, and I'm stretching and I'm doing all these things. Um, but I still get this weird low back pain, and one of the things I like to remind people, structure wise, cervical spine and lumbar spine are closely interrelated. And often I find if you're hurting in one area, you're hurting in the other as well. Um, but there's also something to be said for the way the body deals with that, kind of chronic, low grade, constant inflammation and how it expresses that, um, especially when you have things like, scar tissue now where healthy tissue was. Um, that kicks off its own cascade of, of irritation and inflammation, um, that if you don't get some sort of balance, it just serves to just continue. And that's kind of what I mean when I say, there's that dark side to that moon. Like you're going to get rid of what you think is pain A and pain B, but negate that doesn't keep you from getting another A and another B. It's just, okay, now we're going to, that inflammation just expresses itself differently. Um, because like I said, the root of the problem is still there,
Mm-hmm.
and has not really been addressed by the removal of, um, you know, pr- fire priority number one. That now there's a new fire priority number one, and maybe it's the back of the neck, and maybe it's the shoulders, and maybe it's still the low back. It's just moved, around. Um, or maybe it's in the legs, and now you're getting restless leg syndrome, and maybe now you're maybe now the migraines are no longer on the side, maybe they're more on the top, or maybe it's starting in the back. um, that's been a fun one to kind of chase around with those who come in with menstrual issues and headaches, is as we start to address the root, how those headaches change, whether or not they just go away or whether or not they just move from origin. And in our medicine, that tells us, helps us trace back to the root of that, of what's really causing the issues, um, for the body. So
I find it interesting with daily pain tracking to see these kind of cycles like, oh, at the 2 week mark, the pain spiked. Like, yeah, that would
mm,
be when luteinizing hormone was kicking off before,
mm,
and at the month, oh, I have more dull back pain today. Maybe it's the weather. Well, maybe, but every month at exactly this time, your lower back pain kind of spikes a little bit. And,
mm-hmm,
just something crossed my mind. Like, not only are people, especially if they're losing their uterus, they're losing the estrogen, the endothelium that's going to be creating that hydrogen sulfide, but people lose an arm and they feel that arm for like 10 years. What
mm-hmm.
kind of phantom, uterus pain is going to be there too? I don't think I've ever heard anybody use that term, but, you know,
I think they should. I think that's it. That's brilliant, to equate it as such, because it's such a crucial part. Ask anyone who's lost a limb, that felt like a crucial part to their existence. Your uterus and your ovaries are a crucial part to your existence. We all got here because of one. um, like literally, we all did. So to take that out and not expect consequences from that, and to not expect there to still be some sort of cycle in our existence, is naive at best. So I think equating it to a, phantom organ, I think phantom organ pain should be a new term. I think I'm going to start using it in my practice.
sounds good. So, what kind of advice do you give women who come in who are having these, weird sharp pains and stiffness in the morning, this lower back pain, these pains that have been around for years that you find rooted in their endocrine system, their reproductive system? Let's say, what are the top three pieces of advice that you give your patients that people, listening to this can start to implement or, perhaps tell their friends and family?
One of the first things I definitely look at is inflammatory foods they're consuming. Number one tends to be dairy. I tend to find a lot of people who are coming to me with these kind of pains definitely up their cheese intake or their ice cream intake right before these things really start to kick off. Um, and it's not an easy ask. Ask anyone who's addicted to cheese or ice cream to say, hey, we're going to have to look at that and back it off. But one of the things I do is I say, let's just give me a couple of weeks. Give me a couple of weeks with no ice cream and really being aware of your dairy intake. Um, and let's see what changes. Um, Salads is another one. I live in Southern California, so everyone is very mindful of trying to watch their figure. So, what I try to remind people is the proximity of everything in there, that how important your digestion is. And if your digestion isn't up to par, um, that's just going to make everything else feel worse. Um, so if there's any, especially if there's bowel movement issues, we really look at the dairy. We look at raw food consumption, cold food consumption. The second thing that I typically do is, especially if they're dealing with that stiffness in the morning, is looking at what they're consuming first thing and suggesting that they steep fresh ginger in the morning or have ginger tea, something like that, something warm to kind of help things get started. That's actually a great tip I learned from you. Thank you. Um, but I've noticed, right? I've noticed even in my own life that I have a much better day, if I do that before um, my cup of coffee, which I still do. Um, it kind of sets your day up a little bit better, and it also it's twofold, right? Because you're also giving that third suggestion of being more mindful, being more aware of how your body responds to the things that you're putting in it and on it. Um, and taking that minute that you're taking to steep your ginger and saying, okay, let's check in. How do I feel this morning? Um, how did I sleep last night? What maybe contributed to that poor sleep or that better sleep? Let's do that again if it was better. Um, just starts that cascade of just being a bit more mindful and a bit more aware. Um, and especially after the 2 weeks of watching the dairy intake, people are often surprised how willingly they are to give it up if that's a problem that they notice their symptoms have decreased in 2 weeks because, hey, I didn't eat cheese every night for dinner because I was trying to avoid eating a full dinner. And so I ate a pound of cheese instead, um, which I don't know. I tend to attract a lot of those patients. Um, but once you become aware of what these things are doing to you, it, it feels a lot better to consider, altering your lifestyle a little bit so that you have an increase of better days and a decrease of down days.
So it's mainly dietary. That's the first area that you address.
It really is for me just because that's the thing I can control the least. I can give you herbs, I can give you botanicals, I
Mm-hmm.
can give you a treatment. Um, and if I give you those botanicals and your digestive system isn't utilizing them well, I've just wasted both of our money, honestly.
Mm-hmm.
And that's not fair to either one of us. Also, you're not going to see results, which means you're
That
not
makes you look
going
bad.
to.
You can't have that.
Exactly. I can't have that. I got a rep to protect over here. So, yeah, that's one of the biggest things I can really do to help their system really start to support their decision to do something different. Because the fact that they've already walked into my door means that there's a part of them that's ready to get better.
Mm-hmm.
And the least I can do is to give them the tools to help support that. If we can get through those first 2 to 4 weeks together and develop that trust and you've seen a shift, then the sky's the limit. Let's go. Um, but if we can't get through those first 2 to 4 weeks and you can't sense that you're in good hands, then we need to call somebody to get you in good hands. We need to refer you out and find you someone else. But yeah, absolutely. That's I look at it as my insurance policy. If I can get those three things to happen in the first 2 weeks, then we're on to a great start.
Awesome. Well, thank you so much. I really appreciate you coming on. And if you're up for it, I'd like to do some follow up episodes.
I'd love that. Thank you very much. It's been a pleasure.
I used to carry every herbal formula I could get my hands on. You can just imagine how this clogged up shelf space and mental space. Plus, it gave me a lot to dust every week. We looked at our most effective products, our automatic top sellers, and found that they coincided with the most popular and effective herbal products in East Asia. We decided to focus on the winners and then make them even better. Our research team in Chengdu upgraded these formulas using the highest quality herbs on the planet and rigorously testing them at pharmaceutical standard for quality and safety. You'll want to get your hands on this, and you'll get your supplies at botanicalbiohacking.com. Thanks for listening to the Botanical Biohacking Podcast. I'm your host, Andrew Miles.